So my name is Madison Simak, and in this video today I'm going to be demonstrating how to section a tracheostomy and how to do proper trach care. So this is my patient, and the first thing that I'm going to be doing is I'm going to gather up all of my equipment, and when I enter the room I'm going to double check that I have a obturator. Sorry, I have a hard time saying it. I'm going to make sure I have an extra cannula. I'm going to make sure I have my ambu bag over here and an extra yonker. So then what I'm going to do is I'm going to perform proper hand hygiene. So I'm going to wash my hands, and just as an extra precaution, I'm going to put some hand sanitizer on. And then the next thing I'm going to do is I'm going to identify my patient, and then I'm going to start assembling my equipment on my bedside table over here. So I'm going to make sure that I have my sterile saline, my sterile suction catheter kit, as well as a drape, my mask, and my goggles. So for my suction catheter kit, I'm going to make sure that it is unopened, it's dry, and it's not expired, which it is. And I'm going to do the same thing for my sterile saline. And again, it is. Excuse me. So then I'm going to make sure the patient has privacy, so I'm going to close the curtain, shut the door. This is Mrs. Jones. And then before I get started, I'm going to assess the patient for any kind of pain. Mrs. Jones, are you having any pain? You are? Okay, let me go check your medication orders. So she is having some pain. I'm gonna go look in her medical chart. Looks like she has a PRN order for Dilaudid. So I'm gonna make sure she receives her pain, and I give enough time for that medication to start to kick in before I start sectioning out her trach and taking care of it, because it can be uncomfortable for her. So then what I'm going to do is I'm going to determine the need for the section, and I'm going to verify my order. And so I'm going to auscultate her. I'm going to take a listen. And she sounds a little bit icky, doesn't sound too great. So now I'm going to explain to Mrs. Jones what I'm going to be doing. So hon, I'm going to be sectioning out your trach. I have to do it because you seem like you have a little bit of buildup in there, and I don't want you to aspirate it and then get even sicker. I will then thoroughly explain to her and assure that she knows I will stop suctioning if she enters any respiratory distress. I'm going to instruct her to hold her hand up if it becomes too much and she needs a break. So then what I'm going to do is I'm going to then adjust the head of the bed to a comfortable working height for me and for the patient. And now I'm going to place a towel or a chuck drape across my patient's chest. Just that way I don't want to ruin the gown. I'm going to make sure I don't affect my... All right, Mrs. Jones, there we go. Are you comfortable? You're warm enough in here? Okay. And so then the next thing that I'm going to do is I'm going to check my suction. So she is an adult. So for an adult, I'm going to make sure it's at 150 millimeters of mercury. If she was a infant, I would make sure it was at 100, 120 for a kid, and 80 for a neonatal patient. So now what I'm going to do is I'm going to get a clean pair of gloves. Sorry. So if I'm also going to be using ambu today. So I'm going to make sure I have my ambu bag hooked up to oxygen. I'm going to set it between anywhere from 10 to 15 liters. I'm going to connect it. I'm going to place that within easy reach. So I'm going to grab my ambu bag. I'm going to use this as my ambu bag, so I'm going to make sure it's hooked up and I can reach it fairly easily. So I'm going to place it between the patient's legs. So the next thing that I'm going to do is I'm going to open my sterile catheter kit Again, I'm just in the short time frame that I had in here. I'm gonna double check again. Unopened, it's dry and it's not expired, which it is. So on my table, I'm going to open up the kit. Peel that back, okay. And then the next thing I'm going to do is I'm going to grab the sterile saline container, making sure to only grab it by the edge. Okay. I'm going to remove the container and I'm going to set it aside. Maybe if I can. Okay, and then I will set it aside and I'm going to add sterile saline to it. And if this was a already open bottle of sterile saline, I would make sure to pour out a little bit first and then pour some in. So I have my sterile saline in, okay. All right, now I've done that. I'm going to remove my gloves. I'm going to perform hand hygiene again. So then I'm going to be putting on my goggles over my glasses. And then I will be putting on my mask as well. So then the next thing I'm gonna do is I'm going to begin putting on my sterile gloves. So I'm going to grab my package. Make sure I'm only grabbing it by the outside, maybe. Okay. I'm going to place it over here. Open up my packaging, making sure to only touch the outsides. Make sure the cuff end is facing me. I will unfold the top part first, bend that one back, unfold the bottom. Make sure to kind of pull the paper out so that way it doesn't pull back on. So with my non-dominant hand, I'm going to grab the cuff of my right hand. I'm going to carefully and so now that that is on, it's not on all the way properly, but that's okay. I will adjust it after I put on my left glove. So I'm going to use my 4 fingers, keep my thumb up, walk my 3 fingers into the cup of my other hand, keeping my thumb up. Now that both my sterile gloves are on, my dominant hand, I'm going to grab my suction tubing over here. I'm going to disconnect that. And then with my clean, non-dominant hand, I'm going to then grab my sterile catheter wrapped in my hand, and I'm going to then connect the tubing. I'm using a computer wire. So we're gonna pretend that my computer wire is connected because it actually won't fit in. So I'm gonna unwrap the sterile catheter from my hand. And I'm gonna make sure I'm not occluding the suction over here. I'm then going to dip my sterile catheter in my sterile saline, get the tip wet, and then I'm going to hold my suction catheter in my dominant hand, and then I'm going to use my ambu that's already hooked up to oxygen, and I'm going to give a few breaths to my patient, 3 to 6 preferably. I'll give her another one, and then I will remove that. Itch on my arm. Removing the ambu bag with my non-dominant hand, and then with my dominant hand, I'm going to quickly insert the catheter, and I'm going to advance it to the predetermined length. I'm going to make sure that I'm not occluding my suction valve over here. Okay, so I'm going to, all right, Mrs. Jones, honey, we're gonna insert your catheter now, okay? Just really quick and fast. 1, 2, there we go. And now that it's in, came out. Alrighty, it's in. So I'm going to apply intermittent suction by occluding the valve over here. I'm gonna go about 10 to 15 seconds, no more. So we're gonna do it a couple of times. I'm gonna make sure to slowly rotate that catheter to make sure I get all of the gunk out. Okay, we're gonna stop. We're gonna do it a couple more times. Mrs. Jones, how are you doing on pain? No pain, okay. We're gonna go one more time. Rotating. All right, hon, we're gonna finish up here, okay? And now I'm going to remove it. I'm going to connect with my non-dominant hand. Ambu, 1, 2. One more time, really quick, in, suction, intermittent suction, and when I'm doing that, I'm going to make sure that I'm going to give about 30 seconds to a minute break. I'm going to encourage the patient to take a couple of deep breaths, to cough. Okay, all right, honey, this is our last one, and then we're done. Okay. Pull this out, give her a few more breaths. And so now that we're done suctioning her trach, I'm gonna suction at her mouth. All right, honey, open your mouth for me. And now when I'm doing this, I will not enter the trach anymore. This is gonna be the only time this enters the mouth. It will not go back into the trach because the mouth is considered not sterile. All right. So, once I'm done, I'm going to coil up the catheter in my gloved hand. And then I'm going to remove my glove with the catheter inside. Same with my other one. I will place it here. And I can remove the drape now if I see that. And now I'm going to dispose of this in a proper receptacle. Use those later, so they're going to go over there. Now this is when I would put on a clean pair of gloves. And I would wash my hands and put on a clean pair of gloves. We'll do a little bit of hand hygiene. And then I would give the patient some oral care, brush her teeth, make sure that it's moist, that she's not having any chapped lips. I would check her oral mucosa, kind of do a full mouth assessment. And so then I'm going to remove my ambu bag of O2. I'm gonna disconnect it, but I'm going to also, we're gonna get ready to do a trach care. So then I would put my gloves back on. Okay. And then we're gonna stabilize the trach plate. And then I'm going to pull out the camera with the pinch method. I'm gonna begin taking care of the trach. And it looks like Mrs. Jones' cat decided to join us today. This is little shit. So the first thing I'm going to do is I'm going to open up my sterile catheter kit with clean gloves after I've already performed proper hand hygiene. I'm gonna open up my kit and I'm going to remove my sterile gloves from the kit. And then what I'm going to do is grab my sterile saline and I'm going to open it up. If it's already been opened, I'll pour a little bit out first, then pour some into the basin. Okay, and then I'm going to remove my gloves. And I'm then going to open up my new cannula and add it to my sterile field. For this, I'm using a straw. So, little shit. No, hey, no, no, that is a straw. Don't touch. Now I'm going to don sterile gloves. So I'm going to open up the top first. Then I want to put this in. Now I'm dominant hand. Grab the cuff. Try and figure out where my thumb is. All right, my glove's not on properly, but that's okay. I'm going to walk it into the cuff of my other sterile glove. Oh my gosh. Good Lord. So I very clearly need to get bigger sterile gloves next time, because I know. Christ. And now. Good Lord. How tight do. Alright, that's as good as this is gonna get. So, what I'm going to do is I'm going to grab my new cannula. Okay, hey, no, drop it. I'm gonna pretend little shit didn't do that. So then what I'm going to do is pick up my cannula with my dominant hand without the cat ruining my sterile field. And then with my non-dominant hand, I'm going to apply pressure to the plate. And I'm going to now insert my new cannula and I'm going to press the locks to stabilize my cannula. And then what I'm going to do is clean underneath the stoma. I'm going to get my cotton tip applicators and I'm going to dip them in the sterile saline I have here in my kit. No, no, no. Get. No. Dip them and clean in areas of 4. Discard. Little shit can play with those. Cleaning the stoma really well. I want to prevent any sort of infection. Okay. Now that I have done that, I'm going to open up my new collar. Actually, no, I won't. That's not what I do first. Sorry. I'm going to then get my already pre-prepared trach gauze. And I'm going to insert them around the new trach. Okay, and then I'm going to remove my sterile gloving. You need to go. Stop it. Stop. It looks like Mrs. Jones' cat is now fed up. And so now I'm going to get my new collar. I'm going to disconnect the side over here. I will then hook it up. I'm gonna lead it around the neck. Also pulling the old collar with me, hook up the new one, disconnect the old one, make sure I can fit at least one finger underneath the collar. Then I'm going to secure it, checking the stabilization of the plate while I'm doing that. And then I'm going to remove my gloves now that we're officially done. And I'm going to discard of all of my supplies. I will then assist Mrs. Jones into a comfortable working position, or comfortable resting. So hon, do you want to stay where you're at? Yeah? Okay. I'm gonna make sure she's hooked up to her O2. I'm going to make sure the patient's okay with me leaving. Do you need anything, Mrs. Jones? No. Make sure her call light is next to her. Put the patient at the bed at the lowest point. Then I'm going to assess her lung sounds once she's comfortable. Our lung sounds are all bilateral. Now I'm going to remove of any other PPE I have, remove of my masks. Discard in the